Calling here to show you how to work on this area of the elbow that oftentimes will get painful. Now this used to be called tennis elbow, now they're tending to call it more computer elbow because of the fact that when you're moving your fingers a lot, using them a lot, these muscles in through here will tend to tighten and they'll pull on the bone or the attachment site, the tendon, where it attaches right here at the elbow. So we're now calling it more of a computer elbow. And it's kind of a tendinosis, tendinitis sort of thing. So inflammation in the tendon. So there's a few different ways to work with that. Now, there's 3 different muscles that cross over at this junction here. And another thing that can happen is you can get an entrapment or a pinching of the radial nerve, which comes down the back of the arm here and crosses over and comes down. And you're going to feel that pain a little bit farther down than right on the elbow. You're going to feel it. If you go like 2 fingers width down, you're going to feel it right about here. So if this is your more tender spot, you got more radial nerve pain. So keep that in mind because I'm going to show you stretches and exercises and massage for both of those. So what I'm going to have you start with is actually just using your finger. Take your other hand, put your fingers underneath the forearm. That gives you a little leverage. Bend your thumb here, and I'm just going to have you start massaging, not right on the real tender area, but you're going to work your way down toward the hand. And you're going to find some tender spots in there, that's fine. You want to start off nice and light. Okay, we're not trying to elicit any kind of pain, we're just trying to loosen it up. What happens when muscles get very tight is there's not blood and oxygen flow to those areas. So when your muscles are actually working, they create waste products that need to get flushed out by that blood and oxygen. So when that's not happening, when it's really tight, what happens is there's a lot more irritation to the nerves in those areas. Okay, so now once you've done that, what I'm going to have you do is take a little bit of lotion, put it on your hand, rub it on your forearm here, just back and forth. And then you're going to take your knuckles, the flat part right here, and you're just going to slowly, you're going to push with some pressure into this area and slowly massage downward toward the wrist. So notice the speed at which I'm doing this. It's not that fast. Nice and slow, just like so. I'm going to have you do this 3 times. The 3rd time, each time you're actually going to increase the pressure a little bit because as we start to get blood in here, the muscles start to loosen so we can handle more pressure. So the 3rd time, you're going to be using quite a bit more pressure. Make sure it's not creating pain. If it is creating pain, you back off. So once you've done that the 3rd time coming down through here, what I'm now going to have you do is, if your pain is primarily up in this area, right at the elbow here, what I'm going to have you do is find the most tender spot around there. Once you find that spot, then I'm going to have you put your hand out in front of you and you're going to bend your wrist away from there and then back toward there. What this does is it actively moves the muscle that your finger's on. And so that tends to help it to loosen up, especially at the point here where the tendon is. Now, a lot of times when you bend your hand back toward you, you're going to feel pain underneath the pressure site here. So you want to lighten up just a little bit. Now, if your pain is primarily down here, I'm going to have you do the same thing down in here. And you may actually have pain in both locations, and that's fine. So you're going to do that. You're going to go back and forth maybe 10 times. Look for the tender spots. Maybe hit 2 or 3 of them through this area. And then you're going to just gently flex back and forth like this. And that's going to help quite a bit. Now, if your pain is really predominantly right here, what I'm then going to have you do is I'm going to have you take your fingertips and I'm going to have you rub back and forth horizontally here. And it'll feel a little clunky because actually you're going against the grain of the muscle. The muscles come down this way and kind of wrap around. So you're going against the grain of the muscle. And the reason for this is that when there's tendinitis and an irritated tendon, a lot of times it's a lot more fibrous too, which means that you're going to have quite a bit of almost scar tissue like material in there, and you want to break this up. You want to free up the tendon so it can move better. So I'm just going to have you gently go back and forth with your fingertips. Do this about 4 or 5 times. You can try increasing the pressure a little bit, but if it creates pain, stop and go back to light again. So you're just going to go back and forth like so. Now we're going to move on to some stretches. Now we want to stretch out these muscles here. Now that we've actually done some of the massage work and what they call trigger point work, where you're holding and moving, now we want to then stretch them even further. So I'm going to have you start, and I'm demonstrating this all on the right side. You could easily do the same thing on the left side. Maybe you start with your hand out in front of you, and you're just going to very gently bend your wrist. So you're pointing your fingers back toward you. Hold that for 5 seconds, and then bring your hand back up. And just do this about 5 times. So this is how you begin to stretch. Now, once that is comfortable, I'm going to have you then add a little pressure to it. You're going to take your other hand, put it right over the line of the knuckles here, and you're going to actually stretch it even farther back toward you. And you're going to hold that for a good 5 seconds. Let it relax. And then you'd hold it again for about 5 seconds. So that helps to stretch out the muscles through here and to also start to get this radial nerve to move a little bit. So now I'm going to stand up. I'm going to show you a couple of radial nerve stretches. What this does, it allows the nerve to glide back and forth. And so what it does is it frees up the nerve if there's any impingement, any area where it's really locked down, where there might be some adhesion or a muscle that's pushing on it too tightly. So I'm going to show you 2 different exercises, because usually one is more comfortable or seems to work better for a person than the other. So the first one is that you're going to start with your palm facing forward like so. You're going to turn it out, and then you're going to turn it back in toward your side, just like that. So your fingers are almost pointing straight toward your hip. Now as you bring this toward your hip, at the same time you're going to turn your head 45 degrees this way. You're going to tip your chin down toward your chest. So as I bring it here, I'm going to go just like that. Now, as I rotate outward, I'm going to bring my head back up. As I come inward, I'm going to bring it down. So you're going to do this about 10 times. And you'll feel a big stretch through this area. And that's really doing what they call gliding or flossing the nerve. Now that's one way to do it. Another way to do it is called the waiter's tip. And what this is I'm going to take my hand and I'm going to, again, bend my wrist. This time my fingers are going to be pointed behind me, and my arm's going to be a little bit behind me. It's as if I'm waiting for a tip. That's why it's called the waiter's tip. So from this position, you can start just with a stretch like this. You're extending your arm back behind you a little bit. And once you're comfortable with that, you're going to add with that, again, this time bring the head straight forward toward the chin. You're going to hold that for 5 to 10 seconds, relax, let the arm come back, and then you would do it again. And again, I would do this 5 to 10 times. You'll get a very good stretch through here. It starts to free up the nerve. And these are some exercises you can start to play with and see which is most effective for you. Like I said, if this rubbing right here at the elbow causes more nerve pain down in through the forearm, then it means that you don't necessarily have an inflamed tendon here, but the nerve itself is more irritated. And so by pressing on it, you're actually entrapping it a little bit more. So that's why I say if your pain is primarily here, you can do all of these. If your pain is primarily here, you can do all of them except the rubbing back and forth here.